There was a patient in the OPD who came last week. Stable OPD patient, middle-aged gentleman, had a UTI. Urine culture was given. In the report, it is shown growth of E. coli, which is resistant to almost all the organisms. But he was responding very well to nitrofurantoin. So the report came. The patient was so apprehensive regarding, sir, this is the report came, what to do next. Not only that case, many a times referent comes. The culture which was sent, whether the urine or ET culture, the organism which was grown in the lab or in the microbiological lab might be resistant to all the antibiotic as shown here. So you see, this is the organism, Acinetobacter. But if you take the antibiotics, ampicillin, ceftazidime, fluoxetine group, gentamicin, minocycline, piptas, amikacin, cefepime, everything is resistant. This side also resistant. The second page was not kept. This is a sample report. It is not uncommon you might have come across this report. Resistant including everything, meropenem, ertapenem, imipenem, the combination drug, whatever the antibiotics is there in the list, all resistant. The student might be having the doubt, what next? Or even a patient might be apprehensive, or the family members. See, there is one concept called in vivo response and in vitro response. Even though in the culture, if it comes resistant, many a times clinically the patient might be showing the response to the antibiotic. So that is why if a patient is responding to the antibiotic even before the culture reports are available, suppose if the culture reports are available, always look the clinical response, how well the patient is responding. Don't jump and change the antibiotic as per one report. It might not be a reliable one, and suppose if patient is clinically responding very well to a particular antibiotic, continue and complete the course, and probably the patient might be better. Especially in OPD patient, if the symptoms are resolving, probably the in vivo response is very good compared to this resistance report. Only in certain cases where the response is not there, then subsequently we have to treat it as PDR, pan drug resistant organism. Then a combination of antibiotic which is having synergistic action, or a newer antibiotic or higher dose of a previously available antibiotic have to be taken. Probably that ICU scenario or the treating consultant might decide on. In the OPD, if the patient is already responding to an antibiotic very well, if these kind of reports are coming, always consider the difference between in vivo and in the in vitro response. In vivo response might be there. We have seen many patients responding to the antibiotic which is already shown resistance in the culture report. Probably if a combination of 5 to 10 cases together, once we publish, probably that might be available in the literature. So once it is not in the literature, especially for the residents who are in the first year, second year, once it is not mentioned in the literature, don't think it won't occur. It do occur. It is your responsibility to notice these cases, who is responding, who is not clinically responding, and publish those. Then there will be literature evidence, and probably newer concept related to that might be available. Especially in the OPD patient, if it is pan resistance, don't get panic. You might already be responding to the antibiotic if your clinically symptoms are getting better. So this kind of reports if you are getting, always follow up the patient and try to publish that case if being resistant, if there is a good response, so that it will add to the literature evidence. So this is the sample report. Bye bye.